Hi, my name is Dr. Juanita Subrayadoo, and I'm a psychiatrist. Let's talk about prevalent issues around mental health in the Gen Z. What we are seeing in the Gen Zs are that a lot of them are battling with substance use, in particular cannabis, alcohol, and stimulants. Even smoking is on the rise. And this is generally because of a co-occurring mental health issue. Cannabis use in particular, as well as alcohol use, actually any substance that can significantly impair your life has or generally does occur with mental health issues. Some of these mental health issues could be depression, it could be anxiety, it could be mood issues, it can even be psychotic disorders. When it comes to substances, when a person is using a substance, the question to always ask yourself is, why are you really using this substance? What underlying issue are you trying to self-medicate? Especially when it comes to cannabis, we have found that many people are using it for their medicinal or recreational uses, but are actually unaware of the possible downsides. Cannabis can be associated with worsening of a pre-existing condition. So if you are having depression or anxiety, or even pain or other psychological struggles, even if you've experienced trauma that you're struggling to deal with, it can worsen these conditions. Cannabis is also associated with memory impairments. It can affect the way you learn, the way you retain information, even your driver reaction time. So this can lead to an increase in accidents. It can also affect the way you interact with others. So some of the red flags for problematic use of cannabis are the symptoms of tolerance, withdrawal, cravings. If you're using cannabis in hazardous situations, if you're using cannabis despite the negative impacts it has on your life, your family, your relationships, your work or school, even if you try to stop cannabis and haven't succeeded, or even try to reduce it, this is in particular a red flag. There is a misconception that vaping is safer, but it is not safer. It can be even more harmful than cigarettes. It does contain nicotine, and it can still lead to a substance use disorder. It can also result in popcorn lungs, which can be very detrimental to your health and even result in hospitalization. Eating disorders are on the rise amongst Gen Zs and Alphas, and this is because of an increased exposure of unrealistic body images from social media. We're now exposed to celebrities who do go for enhancements on their body to make themselves feel better and look better according to unrealistic body standards. And young children and teenagers then look up to the celebrities and envision themselves in those ways, or foresee themselves as, that should be how I should be looking when I grow up. And the truth is, everybody is unique and beautiful, and you must embrace who you are and your unique characteristics. The dangers of trying to attain those unrealistic beauty standards can be very harmful, and this can result in eating disorders like a binge eating disorder or anorexia or body dysmorphic disorder, because now is when you then start to feel that you are not beautiful, that you need to do things to your body to enhance how you look in order to keep up with the beauty standards. And sometimes, a person may not have means to go for specific procedures. They might start doing things to themselves and mutilating their own body to keep up with those body standards. Or they might be spending a lot of money trying to change the way their face looks, change the way their body looks. They may even go on quite dangerous diets where there's quite severe caloric restrictions, where they may not be eating according to their nutritional needs, and losing weight quite drastically. And you may find that some people start taking diarrheals or diuretics or off-label medication to help them lose weight. Some patients who I've come into contact with even complain of severe binge eating and thereafter purging. So yes, because of these unrealistic body standards, it has pushed our Generation Z and Alpha into a sort of crisis. Social media can be quite powerful, and you can use social media to reach thousands and hundreds of people and impact them in a positive way. But there are the downsides that come with social media. When you are on social media, be very mindful of those who you are following, because not everything is real on social media. Many health professionals will tell you when patients come into their ED or in their consulting room, you might see this picture perfect social media account with the perfect family, the perfect life, the perfect smile. But behind that, there can be a lot of depression, anxiety, mental health struggles, and trauma. So it's never a great thing to compare yourself to someone who looks perfect on social media. Be aware of the possible misconceptions that can come across. And I think the best thing you need to do is live your own authentic life.